This is the esophageal tracheal airway device intubation skill. First, I want to make sure I have on my standard precautions. I've got my safety glasses and my gloves on, and the scene is safe. Next, I'm going to direct my partner to insert an oral pharyngeal airway and to ventilate the patient with 100% oxygen at 15 liters per minute once every 6 seconds. So they'll do that for you. They'll insert an oral pharyngeal airway and they'll ventilate successfully. The patient's now being ventilated successfully with a BVM and an oral airway. In the meantime, I'm going to check out my equipment, make sure everything is here. This person is 6'2", so he's going to get a full-size adult ETAD. I have the device right here, and I'm going to check the balloons for integrity. First I want to do is I want to inflate the balloons and make sure that the valve and the balloons both hold air. So this is a full-size adult, so it's going to use 100 mLs of air in the proximal balloon. So I'm going to inflate the blue port, the blue inflation port, and I'm going to push in the air, 100 mLs. I'm going to take off the syringe. Remember, I'm checking for not only the balloon holding air, but the valve itself holding air. It seems to be doing fine, so I'm going to take out that air. Draw it all back out with the syringe until the balloon collapses. Reset your syringe to 100 for your intubation. Do the same thing with the distal balloon. Go to the white port, the white inflation port. Inflate that, take off the syringe, the balloon, and the valve holding air. So we can take that and remove that air from the balloon, reset to 15. I have with me here is I have a colorimetric device. That's your carbon dioxide detecting device. I have some KY, I have a stethoscope, I have your posi tube for verification process, I have a cervical collar, and I have a tube tamer. So as soon as you're ready to go, you think you're comfortable doing this, your partner would then stop doing bag valve mask ventilations. They would remove the oral pharyngeal airway for you, and then you just make sure you have everything within close proximity, within arm's reach essentially. You're going to stand at the head of the patient. You're going to grasp the patient's tongue and jaw using your thumb and forefinger. You're going to displace the jaw anteriorly and then insert the device down until the teeth align between the two black lines. Next thing I want to do is I want to inflate the proximal balloon. That's the larger syringe. It goes into the blue port, and that seals the mouth and nose. And then we're going to put in 15 mLs into the smaller balloon, and that seals whatever that part of the anatomy might be. It might be in the trachea, it might be in the esophagus. We're not sure yet. Once this is placed, I'm going to place the colorimetric device onto port 1, and I'm going to have my partner ventilate through port 1 using the BVM. So it should look something like this when ready to go. And as soon as you're ready, a couple of seconds here, you're going to grab your stethoscope and you're going to have your partner give you one breath. They give you one ventilation. You listen to the epigastric sounds. If you hear epigastric sounds, if you hear gurgling, you would immediately switch to port 2, the tracheal port. And have them switch over to port 2. Have them give you one more breath. And if you hear no epigastric sounds, have them give you one more breath. Listen to the one side of the lungs, one more breath, the other side of the lungs. So in about 3 breaths, you've confirmed that you are getting good rise and fall of the chest and that you're in the trachea. A couple more confirmation things to continue with. Next thing I want to do is I want to check my colorimetric device. At this point, we've had 3 or 4, maybe 5 breaths in. It's starting to change color, and I see it's yellow in 5.0, so it's good as gold. And the last thing we're going to do is the posi tube. Now, we know this only works on port 2, so consequently, we're going to have to perform this between ventilations. So as my partner gives that one breath, they'll take off the BVM, we'll quickly apply the posi tube, will pull back on the device. If we feel resistance, then we would then know that we will be in the esophagus. But because we know we're in the trachea, we're going to feel no resistance because the trachea cannot collapse. So there's no resistance on port 2. Your partner then continues ventilations without kind of missed ventilation. Now I can secure the device. Take my tube tamer. It's got a long strap and a clamp on the other end. It goes in from the right side of the patient. There's a slot here. The slot always faces the foot of the patient. So now I'm going to put this over the tube. The mouth piece goes in place. You tighten down the little white clamp knob. Bring the strap up from behind the head or the back of the neck. Secure that nice and tight. Take your cervical collar. Remember, the County of San Diego requires we use a cervical collar on all patients, whether it's medical or trauma. Insert that from the right side of the patient and bring the collar over, secure it to the patient. You've now successfully ventilated the patient. Your partner is providing ventilations, and now you're going to document SD lead. So the size was a full-size adult. The depth was the teeth between the black lines. The lung sounds were present with good rise and fall of the chest. There were absent epigastric sounds once we changed ports anyway. Our posi tube was no resistance on port 2, and we had our last D is documentation, and it was yellow and 5.0 for our capnography device. We're done with the skill.